Welcome back, everyone, to the International Training Institute of Health Masterclass. And this is what we're going to talk about, the low back. And I'm telling you right now, everybody gets to a point where they feel like they're carrying the weight of the world on their shoulders, emotionally and sometimes physically, and you feel like your back is going to break. Okay? And I'll tell you something, it's one of our most powerful therapies. So if you're feeling like your back is going to break, and what are situations like that, Abby?
Yeah, totally. So we see it with so many different problems with disc problems, whether it be compressions or bulging discs or herniated discs or sciatic problems or even just muscular tension and tightness and spasms.
Yep, chronic muscle spasms, right? And then sciatica, that's a big one.
Sciatica's huge.
Yeah, it's a big one. So understand something, that this can change so quickly. And I'll tell you why it can change, because most people don't understand the low back. They think it's actually a skeletal problem. They think it's actually a bone problem. It's not. It's a muscle problem. And understand, with that muscle problem, we're going to be showing, I don't want to get into it too much, we're going to be showing it, when we show you the treatment and how we do it, we're going to be laying it all out there for you, all out there for you to judge or to learn and go, wow, this is amazing, okay? And if you don't mind, just before we started to do this show, I just got a phone call. I got a phone call from a very lovely lady who has her son is how old?
3 years old.
He's 3 years old, and he had Lyme's disease, and it took him down neurologically and muscularly. And guess what the doctor said? All the doctor said was this, and a whole bunch of them said this.
Yeah.
He will never be able to stand up, and he'll never be able to walk again. Now, they started with us how long ago?
4 months at max.
No, I think it was
like
longer.
Was it longer than that?
Yeah, it was probably about 4 or 5 months ago.
Yeah, 4 or 5 months
Okay,
ago.
so 4 or 5 months ago, they started with us. His mother brought him, and guess what? Are you ready for this? The doctor that said that he would never walk again because of this neurological condition says that he's going to walk again. I didn't make that up. Okay, so understand something. Do you want the impossible to happen? Just turn it into I am possible. Take massive action like this mother did, and you're going to see that your life can change, and you can change the lives of your family.
Because
So-
3, 2, 1, you got this.
That's right. 3, 2, 1, you've got this. And you know what? Where the mind goes, the body follows. And understand this. With your back, okay, all right, a lot of it's emotional, and a lot of it is your large intestine. Your large intestine sits right in front of your low back. That large intestine that you have been just not knowing what to eat and eating the wrong things, it is 85% of your immune system. And understand something, how could your blood get dirty? How could you get inflamed on a physical level if you didn't absorb your own waste? I want you to think about that. Okay, so we know that the large intestine is 85% of the immune system. We know that it's in charge of waste management. And we know that when you don't know how to manage your waste will be absorbed back into you. And understand, your low back is sitting right behind your large intestine. And the other thing too is that waste that you're reabsorbing has to be picked up by your kidneys. Oh, and those kidneys, you're not drinking structured water, and you're definitely not drinking enough water. So now we know that those kidneys are getting fried out. And we also know that you're feeling terrorized by life because you watch the news, you listen to your family about henny penny, the world's ending. So you're always dumping adrenaline out of your adrenals that sit like caps, okay, on top of your kidneys, which sit right here underneath your ribs. And when you're starting to feel low back pain, well, guess what? You're going to say, well, I've got low adrenals. No, you don't. You've got high imaginary stress, and you're reabsorbing your waste. Okay, and that's the problem. So let's learn how to manage our stress. Let's learn how to do the perfect day. Let's learn how to do daily gentle cleansing every day instead of, oh, I cleanse every 6 months and I pile it up like a manure pile. And when I feel like crap, then I go and I get exhausted trying to cleanse. And then I feel so much better. Well, why didn't you just stay there? Okay, and the reality is we're going to show you also videos about how we do pelvic stretching. That'll blow your mind.
It's amazing.
That'll just take your life by storm. And you can buy a Doc of Detox
Pelvic
pelvic
expander.
expander, and you can put it in your own home, and it's inexpensive. So understand that. So we're going to be showing things to you that are going to end this low back problem and feeling like your back is busted. So don't tell me that you're going to have surgery, or you got to go to the chiropractor every week, or you just bought a package for 2 years, all right? Or you're going to get acupuncture to try to deaden the pain. Let's stop managing the pain. Let's become the master of our mind, to be a master of our body, and understand something here right now. Pain is your friend. And when you make it your enemy, then you're going to come to your end. Or if you don't, you're going to have pain and suffering for the rest of your life and limping down the street. Is that what you want? You want to feel like a victim of life? No, let's not do that, okay? I promise you, we will help you make changes.
Yeah. And this treatment is honestly one of our most popular treatments too. This is something that most people come in to get done.
If somebody comes into the office and they're not too sure what they want worked on because they have little bits of problems everywhere, but they want to see what we're about, we usually start with a upper back and neck or a lower back treatment.
Yeah, and we try to get them to understand, go into the pelvis, because, okay?
That's where it begins.
Yeah, that's where all that energy is.
That's why before we start any treatment, we really educate our clients on exactly what's going on in them, and we talk to them while they're doing the pelvic expander stretch and really teach them why the pelvis is the most important part. And then they're more open to really getting that work done when they really realize that that is the root. And once that we can release that,
that's right,
the rest of the problems are going to go away.
And that's it. And understand something. We don't expect you to jump on this because not everybody's doing it. If everybody's not doing it, then you don't want to do it because we follow the herd. I wouldn't do that because you're a statistic, but sooner you break away from the herd and the sooner you get trusting us, because really, you just need to trust in yourself. I mean, everything that we have been talking here on all these shows is totally logic. It's just logic. And all we want you to do is be logical and love yourself enough to try something different. Okay? If you want to be outstanding, you're going to have to stand out because it sure isn't working the other way. All right. So what's our next show?
So the next one we're going to be touching on is arthritis. So we have talked about arthritis through some of the other treatments, but we want to really focus on this because this is the main thing that people have going on in their bodies, and that's inflammation in their joints.
Yeah, in all the joints. And it's just inflammation in the joints, and we made it into a disease. And how do you like being a disease? Not great. So anyways, thanks for joining us. I won't bust your back anymore, and we'll see you on the next show.
But if you would like your back not busted but fixed, check out our low back treatment video.
That's right. Bye.
Bye for now.
Welcome back, everyone, to the International Training Institute of Health Bodywork Masterclass. And what we're going to do now is we're going to talk about and show you how we work on the low back and how we can tell you that we're going to guarantee that you're going to get your back back. Okay?
So the low back, this is a big one for people. It's one of our most popular treatments. Most people are living a sedentary lifestyle. They're sitting at desks a lot all day long. So they get a lot of pressure put into their low back and hips. Most people are constipated or their bowels aren't really moving that well, and that all is pushing onto the low back. So that waste is actually seeping through into your tissues and causing scar tissue to form in your low back to wall off the pain, to wall off the toxins, which can also lead to more crystallization and displaced calcium if things go too long.
Absolutely.
So we're going to talk about some emotions that can get stored in the low back as well. So the biggest thing is fear with the low back, and this is to do with the whole pelvis and hips. Fear of life and insecurity. Too much to cope with because life is overloaded. You might have some anger issues or the stress of an unsatisfying job or home life. And the biggest condition that's in the low back would be sciatica.
Yeah.
Other than that, it's just more so pain.
Pain.
Yeah.
Yeah, and most people don't even understand where the pain is coming from, but a lot of times it can actually be coming from your coccyx.
Yeah.
And you think that, you've got all this problem in your pelvis, but it could be actually your coccyx, because your coccyx has to move. It's got to have circulation around it. And with most people, it becomes cemented because they have so much, like you said, they have so much bowel problems, but because the whole family's like that, you know what? Nobody notices it. It's like, if I could say to somebody, I'd go, so do you know what love is? And do you have a loving family? Of course I do. Well, it's because it's the only family you're with. But I have never really, it doesn't sound that great, but every family has a lot of trouble with love. They have a lot of trouble with detoxifying. They have a lot of trouble with their bowels, but everybody thinks it's normal.
Yeah.
Right? And we can thank the systems out there, because the systems have set the bar so low and told everybody that that's normal, and that this is where this is your limit, when actually your limit is unlimitless. Okay.
Exactly.
All right.
All right, so we're going to talk about how we do our treatment for the low back. So we have a few areas that are our main focus, which are the sacrum, the SI joints, the coccyx, and then we are working with the hip bone or the iliac crest. And we are going to come through the glutes and working with the ischial tuberosity or the sit bones, and those are just the bones that you sit on, essentially. So the sacrum is the sacred bone of energy, as I've mentioned before, and when we have matting of scar tissue on the sacrum, we don't have that flow of energy moving up our spine into our brain. So very, very important to always address the low back for everybody, because we want to have that flow of energy coming through. So
Yeah, you don't want it to be blocked. And it's all about blocks. Remember that. We talk about that,
Yeah.
All these physical blocks are creating energy blocks that are creating circulation blocks. And then it's just the domino effect.
Exactly.
All right.
So let's get started with how we do the low back. So we're going to first start with a more of an extension in our arm when we're working on the sacrum, because there isn't a lot of tissue depth. So we will go in with more extension with our windshield wiper technique and shave the sacrum. And I'll let Sage take it.
So we're working on the sacrum. The sacrum's right here, and it's almost like in a triangle diamond shape. And it's going to be a flat, more so bone. And you're going to feel, like Abby said, matting on it. So pretty much adhesion, scar tissue is kind of just rooted in, overlapped itself over and over to create this nice mat for you that creates all this great pain. So we really want to go in, work this for a good amount of time, really loosen that up till you feel like nice heat's coming in. You've really gotten that spinal fluid starting to move, and then we're going to work our way and trickle our way slowly over to where, and with some people, you'll see indentations in their back, and that's exactly where their SI joints are going to be located. So that's their sacral iliac joint. We're going to want to kind of work all the way around the sacral iliac joint in the little fossas, under, over.
Really clean that out,
Yeah.
because they should be moving like this when you walk, not like this.
Exactly.
When they get locked, you waddle, okay? They should be moving like this. And that's why you'll say, oh, my leg is 1 inch longer than the other leg. No, it isn't. Your sacroiliac is
frozen.
out of place.
Exactly.
And you know that you can go and you can do an adjustment, and that's good enough, but it's not good enough, because it's just going to pop out until you clean that crystallization,
Exactly.
calcification, and scar tissue out. And when you go in there and you see how much is there, okay, so you can do something temporary, or you can do it for long term. Okay.
And one thing that we do see, especially with people who are more overweight or women who have had babies, so they were carrying a lot of weight for 9 months or more, depending how many kids they've had, you will find that this almost becomes like a rubber mat because of that weight being pulled. So your body really puts an even more protective layer on that low back. So when you're working with something like that, you really want to make sure that the client is on the perfect day and really trying to master their health, really reduce that excess weight in the abdomen, because it is putting so much extra strain on your low back.
Exactly. And so after you finish cleaning out one of the SI joints, you're going to work your way up to the top of their hip. And then when you're at the top of the hip, you're going to follow that down through the iliac crest. So this would be the iliac crest on her. And then after you feel, because you can't get all the way down here without getting uncomfortable, so you only work to where you're comfortable, because your uncomfortability is just as important as the client, because they're just lying there. And so then you're going to work your way all the way through their glute, coming down, heading towards their coccyx. And so when we work their coccyx, we're actually going to want to come all the way down to the tip of the coccyx tail, and we want to play that as well. Do the whole routine from one side and then the other, because we have to play all the angles.
And you want to make sure that you've got movement, okay,
In the tail.
in that coccyx. That and everybody's is frozen, and believe it or not, that's going to cause you pelvis problems up front. Okay, that cannot be frozen. You need to make sure there's movement there, and you're going to feel it. It's just like beef jerky lining that thing. And I know that it's hard to believe, but it's because of your large intestine, because we have been taught to attack our large intestine with antibiotics and a terrible diet.
Totally.
Yeah.
And you will also find around the sacral edge, which is just like right where the Sage will pointed out here, you're going to find like a dam of scar tissue on both sides, and you'll find it on everybody. And I mean, pardon my French, but people are tight asses. And that's why they find it there a lot of the times, right? So it's really time to loosen up and let things go, because we don't want to have that toxic tissue in this area. We really need to make sure that this is all blood flow coming through.
That's right. You
lymph
want to
flow
let
coming
go.
through, circulation
You
coming
want to
through.
let go and get the cork out.
Exactly.
That's right.
Yeah. And then from there, we are going to work.
You could work down, and especially for people who get sciatica, this is the main area, and that's the sit bone, the ischial tuberosity. If you just take your hand and push underneath your bum cheek, you're going to feel a ball, almost like a joint in there, but it's actually just your ischial tuberosity, and that ball is actually scar tissue encasing that ischial tuberosity, causing that contraction, causing that inflammation, irritating that sciatic nerve that's trying to go through that port.
It's
but
not
there's
letting
so
it
much
slide through the
crystallization.
sleeve.
There's
It's
so
like
much
a sleeve, right? It's like a sleeve.
Exactly.
I didn't mean to cut you off.
It's all good, my man.
It's a sleeve, and it's stuck, right? That's all. It's glued.
Yeah.
Okay, and that's because of what? The crystallization you just said, and the lactic and uric acid. Okay?
Yeah. And then when we do the low back treatment, we only do one side at a time. So we would take care of one side, switch sides, repeat on the same side before we move on to the other side, because we don't want to have that side tender when we're going back and forth. So we always focus on one side at a time. And that takes care of the low back.
Is there anything else?
That's it.
Okay. All right.
Yeah. And of course, for aftercare, please check out the pre and post care video, because we talk about everything we do pre-treatment. So we have the pelvic expander, our Bioptron, the Avicin. We do a whole bunch of different therapies prior to, and then afterwards, of course, we're going to use the DMSO essential oils. We're going to talk about bringing the energy medicine home, if that's an option for them, because that's where the true healing is going to take place. And with a low back treatment, it can be anywhere from 3 to 5 treatments to really restore the low back. And
But what we'll do is we'll show you in one treatment.
That you can remove at least 60% of the scar tissue.
100%.
And you know what? Here's the thing, right? I know we want the physical changes, but soon as we can get rid of the mental fear that there's no hope. So we're going to teach you that, health is not about hope. It's about knowing.
Yeah.
Okay? And you're going to know how to do it, because we're going to teach you how to take your power back.
Exactly.
You got it.
Right, Sage?
You got it.
Abby?
All right, you got it.
Thanks for joining us. We hope you enjoyed the show. We hope to see you on the next one.
See you there.